In recent years, microclots have been identified as a potentially key problem within long COVID and ME-CFS. And those same researchers who have done the research to find these microclots have also developed a treatment protocol using anticoagulation medications. And in this video, I'm going to tell you all about a study that looked at how effective these medications were in treating 91 long COVID patients, and the results indeed were really promising. But first, if you're new to this channel, this is the place where I aim to present in a simplified and accessible way research into ME-CFS and long COVID so that you can be empowered to understand your condition better. It's also a place where I talk about the kinds of treatments that I myself, as an ME-CFS patient, have tried in order to improve my condition. Now, in a previous video, I talked all about microclots, how they're formed, the kind of symptoms they create, how you might know if you have them or not. But in this video, we're talking about medications. And for that reason, I must give the disclaimer that nothing in this video is to be construed as medical advice. I am simply presenting a summary of a research paper that examined the use of these medications for long COVID. I will emphasize this point again later because anticoagulant medications are no joke and they can be very dangerous at times. This is a protocol that can only be done under careful medical supervision. Alright, so let's get into it and talk first about this study. So the title of the study was Treatment of Long COVID Symptoms with Triple Anticoagulant Therapy, so 3 anticoagulant drugs. It was done by many of the names who have done the trailblazing research in relation to microclotting: Laubscher, Assad Khan, Fenter, Jan Pretorius, Risha Pretorius and Douglas Kell. It was published in March of 2023. And this study took 91 long COVID patients. Some of them had only had the illness for a shorter period of time, less than 6 months, and others had had it for over 6 months. And we put all of them onto this triple anticoagulant protocol. So that involves 3 drugs: aspirin at 75 micrograms once per day, clopidogrel at 75 micrograms once a day, and apixaban, a more standard blood thinning medication, at 5 micrograms twice per day. The first 2 drugs there, aspirin and clopidogrel, are aimed at reducing platelet hyperactivation, while apixaban is aimed at thinning the blood in a more standard way. In addition, patients were also put on the stomach protecting drug pantoprazole in order to try and limit risks of bleeding in the stomach, and that was at 40 micrograms per day. Now, the aim of this treatment is not actually to remove the microclots that are already there. Rather, it is to prevent the formation of new microclots, and in particular to prevent their formation for the treatment period, which might be 2 months in some cases, or 6 months or more in others, depending on the severity of the microclotting problem in that particular patient. So all of these drugs are capable of stopping the body from churning out these microclots in excess. Now, what that means is that while you're on these medications, not only do you not create any new microclots, but the body's own pathways to break down the microclots that are already there are able to be far more successful at that endeavor. So basically, very simply, the medications prevent the creation of new microclots, and at the same time, the body then has an easier time of removing the microclots that are already there itself. And therefore, ideally, at the end of the treatment protocol, you are reset on the microclotting front. The ones that are there that are gone, and the blood is flowing and the circulation is improved and the oxygen transfer is improved. So let's read now what the authors say about this aim of the study. The purpose of the anticoagulant regime was to reverse the pathological hypercoagulable state and restore normal clotting physiology. The aim was not to make the patient hypocoagulable, so to make the blood too thin. This triple therapy regime therefore prevents platelet hyperactivation and prevents new microclots from forming, whilst allowing the body's own fibrinolysis pathways to clear existing microclots. So fibrinolysis refers to the breaking down of fibrin and clotting pathways. Now then, what about the results? So these patients were on this therapy for, as I said, somewhere between 2 and 6 months, and the results were really, really promising. So they asked patients what were their worst symptoms prior to the treatment, and then at the end they saw how many of these patients still reported those symptoms. The results were very good. So here they are. So as you can see, with cognitive dysfunction, 82 patients reported this before treatment, while only 21 reported it after. Fatigue went from 81 to 18 patients. Shortness of breath went from 61 to 11 patients. Muscle joint pain went from 52 to 12. Depression and anxiety 43 to 8. Sleep disturbance 50 down to 11. Palpitations 51 down to 7. Chest pain 32 down to 6. Digestive problems 26 down to 6. So those results were super encouraging. They also measured by what extent patients reported improvement in their condition. So let's now look at those results. So this was the questionnaire that they asked patients, a scale of 1 to 7, how much had they improved? And number 1, no change or condition has worsened. 3 patients reported that. Secondly, almost the same, hardly any change at all. 8 patients reported that. A little better but no noticeable change. That was 2 patients. Somewhat better but the change has not made a real difference. That's 6 patients. Moderately better and a slight but noticeable change was 15 patients. Better and a definite improvement that has made a real and worthwhile difference was 25 patients. And a great deal better, a considerable improvement that has made all the difference, was 32 patients. And if we take the last 3 measures, that was 80% of the patients in the study, therefore were reporting significant improvement from this protocol. This really speaks to something very encouraging. Now, I personally don't believe that microclots are the cause of long COVID or ME-CFS, but they do seem to be something that does develop as a secondary problem. And it is my belief that if you can treat anything anywhere, it helps everywhere. I think there's so many different burdens going on in the bodies of ME-CFS and long COVID patients that if those burdens can be reduced, then everything else can also improve because the body is able to function better and the patient feels better, and it can possibly lead to an upward spiral. Now, of course, in relation to taking anticoagulant drugs, as I mentioned earlier, it can be risky. So let's now look at what kind of side effects were reported in this study. Out of 91 treated patients, 75 reported bruising that did not require medical attention. 5 patients reported minor epistaxis, so that means nose bleeding. 2 female participants experienced increased menstrual bleeding, and 1 sustained a gastrointestinal bleed, necessitating hospitalization and a 2-unit blood transfusion. So that was obviously more serious in that case. 3 patients reported bleeding after they cut themselves, of whom 1 required medical attention. We propose that the reason for the relatively low bleeding risk of long COVID patients on triple therapy is due to the underlying pathophysiology which induces a hypercoagulable state, so very thick blood. So the fact what they're saying here is because the blood is already so thick from all the microclots, when you are taking these medications, there's not so much risk of bleeding because the blood is already quite thick in the first place. It's very important now to emphasize again that this treatment is not something to be done without careful medical supervision. And the authors of this paper also make that caution. So they say, it is important that clinicians and patients are aware this treatment protocol remains experimental for the time being. It should only be used by expert physicians with a thorough understanding of clotting physiology, including the specific abnormalities seen in long COVID. Patients need to be counselled regarding the relative risks and benefits of treatment and require close clinical supervision. So whatever you do from watching this video, do not go and buy anticoagulant drugs from the dark corners of the internet and experiment on this yourself. It could be very dangerous. And I myself have come across 1 long COVID patient who was taking anticoagulant drugs under the supervision of a doctor who was not experienced in this and who was not really trying to be experienced in this. And that patient almost died from severe gastrointestinal bleeding, had to have an emergency surgery which saved her life. I think what to make of all of this, I think that this study is very good. It shows fabulous results. It shows that microclotting is a real problem in a lot of patients with ME-CFS and long COVID. It gives us a potential short time frame treatment protocol that can actually reset this pathophysiology, which is a really exciting thing. On the other hand, I think it's probably quite hard at this time to find many doctors or consultants who would be prepared to prescribe this. They're not going to be familiar even with the idea of microclots. They're going to feel that it's a big risk to prescribe someone with 3 anticoagulant drugs at once. And so really, I think it's going to be some time before this kind of treatment becomes more established. Nevertheless, at the very least, as a proof of concept, it really was an excellent study. Would I myself want to take this protocol? Probably not. I think that by nature I'm quite risk averse, and I probably wouldn't want to take the risks of the various kinds of bleeding from such an approach. If I was definitely under the clinical supervision of someone very experienced in this, then maybe. But in my own case, I actually opted to go to Germany in order to have HELP apheresis treatment, and I did a video all about that, which you can see linked above. And that treatment, which involves blood washing, taking the clots out of the blood, was very successful for me and did actually resolve my microclotted state without taking any medications. So that's it for this video. I hope you found it helpful. Please leave your comments down below. What do you think of this treatment protocol? Have you tried it? Would you try it? I also offer a consultation service if people are interested in talking to me about research into ME-CFS or treatments with which I'm more familiar, like brain retraining. And I also have down below a free medical hypothesis about the causes of excessive thirst in ME-CFS. So I look forward to engaging with you, and I'll see you next time.